101. What is the most critical side effect to monitor for in a patient receiving fentanyl for pain management? Answer: respiratory depression. Rationale: fentanyl, a potent opioid, can cause significant respiratory depression. Nurses must monitor respiratory rate and oxygen saturation, ensuring naloxone is available for overdose. 102. What is the priority nursing action for a patient with a serum magnesium level of 1.2 milliequivalent/L while on magnesium sulfate? Answer: notify the healthcare provider immediately. Rationale: hypomagnesemia, defined as a serum magnesium level less than 1.5 milliequivalents per liter, indicates ineffective therapy or excessive excretion. Notifying the healthcare provider ensures adjustment of the dosage or further evaluation to prevent complications, such as seizures. 103. What is the most common side effect of duloxetine in patients with depression? Answer: nausea. Rationale: duloxetine, an SNRI, commonly causes nausea due to serotonin and norepinephrine effects on the GI tract. Taking with food can help reduce this side effect. 104. What lab value should be monitored in a patient receiving rifampin for tuberculosis? Answer: liver function tests, ALT/AST. Rationale: rifampin can cause hepatotoxicity. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation if needed. 105. What is the primary patient education point for a patient prescribed sildenafil for erectile dysfunction? Answer: avoid taking with nitrates to prevent severe hypotension. Rationale: sildenafil can cause profound hypotension when combined with nitrates, e.g., nitroglycerin. Patients must be educated to avoid this life-threatening interaction. 106. What is the most critical adverse effect of heparin in patients with deep vein thrombosis? Answer: bleeding. Rationale: heparin, an anticoagulant, increases bleeding risk. Nurses should monitor for signs like hematuria or bruising and educate patients to report unusual bleeding. 107. What is the priority nursing action for a patient experiencing a hypertensive crisis while on phenelzyne? Answer: administer an antihypertensive as prescribed and notify the healthcare provider. Rationale: phenelzyne and MALI can cause hypertensive crises, especially with tyramine-rich foods. Immediate antihypertensive treatment and provider notification are critical to prevent stroke. 108. What is the most common side effect of montelukast in patients with asthma? Answer: headache. Rationale: montelukast, a leukotriene receptor antagonist, commonly causes headaches. Nurses should educate patients to report persistent or severe headaches for evaluation. 109. What is the primary nursing action for a patient with a tacrolimus level of 20 nanograms per milliliter? Answer: hold the tacrolimus dose and notify the healthcare provider. Rationale: a tacrolimus level above 15 nanograms per milliliter indicates toxicity, risking nephrotoxicity or neurotoxicity. Holding the dose and notifying the provider allows for dose adjustment. 110. What is the most critical side effect of adalimumab in patients with rheumatoid arthritis? Answer: increased infection risk. Rationale: adalimumab, a TNF inhibitor, suppresses the immune system, increasing susceptibility to serious infections. Nurses should monitor for fever or signs of infection and educate patients to report symptoms. 111. What is the primary patient education point for a patient starting insulin glargine? Answer: inject at the same time each day to maintain consistent blood glucose control. Rationale: insulin glargine, a long-acting insulin, requires consistent timing to provide steady glucose control and prevent hypoglycemia or hyperglycemia. 112. What lab value should be monitored in a patient receiving tobramycin? Answer: serum creatinine. Rationale: tobramycin, an aminoglycoside, is nephrotoxic. Monitoring serum creatinine detects early kidney damage, allowing for dose adjustment or alternative therapy. 113. What is the most common side effect of sumatriptan in patients with migraines? Answer: chest tightness. Rationale: sumatriptan, a triptan, can cause transient chest tightness due to vasoconstriction. Nurses should educate patients that this is usually benign, but to report persistent symptoms. 114. What is the priority nursing action for a patient experiencing neutropenia while on methotrexate? Answer: notify the healthcare provider immediately. Rationale: neutropenia, a serious side effect of methotrexate, increases infection risk. Notifying the provider ensures drug discontinuation or supportive care like growth factors. 115. What is the most critical adverse effect of long-term valproic acid therapy? Answer: hepatotoxicity. Rationale: valproic acid can cause liver damage, especially in the first 6 months. Monitoring liver function tests and symptoms like jaundice is essential for early detection. 116. What is the primary patient education point for a patient prescribed apixaban? Answer: report signs of bleeding, such as black stools or nosebleeds. Rationale: apixaban, a direct oral anticoagulant, increases bleeding risk. Educating patients to recognize and report bleeding ensures timely intervention to prevent complications. 117. What is the most common side effect of atypical antipsychotics like olanzapine? Answer: weight gain. Rationale: olanzapine commonly causes weight gain due to metabolic effects. Nurses should monitor weight and educate patients on diet and exercise to mitigate this side effect. 118. What is the priority nursing action for a patient with a carbamazepine level of 15 micrograms per milliliter? Answer: hold the carbamazepine dose and notify the healthcare provider. Rationale: a carbamazepine level above 12 micrograms per milliliter indicates toxicity, risking seizures or hematologic effects. Holding the dose and notifying the provider allows for dose adjustment. 119. What lab value should be monitored in a patient receiving long-term ibuprofen therapy? Answer: serum creatinine. Rationale: ibuprofen and NSAID can cause nephrotoxicity with long-term use. Monitoring serum creatinine detects early kidney damage, prompting dose adjustment or discontinuation. 120. What is the most critical side effect of trastuzumab in breast cancer treatment? Answer: cardiotoxicity. Rationale: trastuzumab can cause heart failure, especially in patients with pre-existing cardiac conditions. Nurses should monitor for dyspnea or edema and ensure regular cardiac assessments. 121. What is the primary nursing action for a patient experiencing angioedema while on enalapril? Answer: discontinue enalapril and notify the healthcare provider immediately. Rationale: angioedema, a potentially life-threatening allergic reaction, is a rare but serious side effect of ACE inhibitors like enalapril. Stopping the drug and notifying the provider is critical. 122. What is the most common side effect of thiazide diuretics like hydrochlorothiazide? Answer: hypokalemia. Rationale: hydrochlorothiazide increases potassium excretion, leading to hypokalemia, which can cause muscle weakness or arrhythmias. Monitoring potassium levels is essential. 123. What is the priority patient education point for a patient starting isotretinoin for acne? Answer: avoid pregnancy due to teratogenic effects. Rationale: isotretinoin is highly teratogenic, causing severe birth defects. Patients must use 2 forms of contraception and enroll in a risk management program like iPledge. 124. What is the most critical adverse effect of beta-2 agonists like terbutaline in preterm labor? Answer: tachycardia. Rationale: terbutaline stimulates the heart, potentially causing maternal or fetal tachycardia. Nurses should monitor heart rate and report palpitations or rapid pulse. 125. What lab value should be monitored in a patient receiving sirolimus? Answer: lipid levels, cholesterol, triglycerides. Rationale: sirolimus, an immunosuppressant, can cause hyperlipidemia. Monitoring lipid levels ensures early detection and management with statins or lifestyle changes. 126. What is the primary nursing action for a patient with a lamotrigine level of 18 micrograms per milliliter? Answer: hold the lamotrigine dose and notify the healthcare provider. Rationale: a lamotrigine level above 15 micrograms per milliliter indicates toxicity, risking seizures or rash. Holding the dose and notifying the provider allows for dose adjustment. 127. What is the most common side effect of oral contraceptives like ethinyl estradiol? Answer: nausea. Rationale. Oral contraceptives can cause nausea, especially during the first few cycles. Taking with food or at bedtime can help reduce this side effect. 128. What is the priority nursing action for a patient experiencing Parkinsonism while on haloperidol? Answer. Administer an anticholinergic like benztropine and notify the healthcare provider. Rationale. Parkinsonism, an extrapyramidal side effect of antipsychotics, requires anticholinergic treatment to relieve tremors or rigidity, followed by provider notification for drug adjustment. 129. What is the most critical side effect of long-term omeprazole therapy? Answer. Increased fracture risk. Rationale. Long-term omeprazole use reduces calcium absorption, increasing osteoporosis and fracture risk. Nurses should educate patients on calcium supplementation and monitor bone health. 130. What is the primary patient education point for a patient prescribed doxycycline? Answer. Take with a full glass of water to prevent esophageal irritation. Rationale. Doxycycline can cause esophageal irritation or ulceration if not taken properly. Drinking ample water and remaining upright after administration reduces this risk. 131. What lab value should be monitored in a patient receiving voriconazole? Answer. Liver function tests, ALT/AST. Rationale. Voriconazole, an antifungal, can cause hepatotoxicity. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation. 132. What is the most common side effect of cholinesterase inhibitors like donepezil? Answer. Nausea. Rationale. Donepezil, used for Alzheimer's, increases acetylcholine, causing GI side effects like nausea. Taking with food can help reduce this side effect. 133. What is the priority nursing action for a patient with a valproic acid level of 120 micrograms per milliliter? Answer. Hold the valproic acid dose and notify the healthcare provider. Rationale. A valproic acid level above 100 micrograms per milliliter indicates toxicity, risking hepatotoxicity or seizures. Holding the dose and notifying the provider allows for dose adjustment. 134. What is the most critical side effect of bleomycin in cancer treatment? Answer. Pulmonary toxicity. Rationale. Bleomycin can cause pulmonary fibrosis, a potentially fatal side effect. Nurses should monitor for cough or dyspnea and ensure regular pulmonary function tests. Question 135. What is the primary nursing action for a patient experiencing hypoglycemia while receiving glipizide therapy? Answer. Administer 15 grams of fast-acting carbohydrates. Rationale. Hypoglycemia, defined as a blood glucose level less than 70 milligrams per deciliter, requires immediate treatment with 15 grams of fast-acting carbohydrates, such as fruit juice or glucose tablets, followed by rechecking the patient's blood glucose level after 15 minutes. 136. What is the most common side effect of MALIs like selegiline? Answer. Orthostatic hypotension. Rationale. MALIs can cause blood pressure drops upon standing due to autonomic effects. Nurses should educate patients to rise slowly and monitor for dizziness. 137. What is the priority patient education point for a patient starting rivaroxaban? Answer. Report signs of bleeding, such as unusual bruising or blood in urine. Rationale. Rivaroxaban, a direct oral anticoagulant, increases bleeding risk. Educating patients to recognize and report bleeding ensures timely intervention. 138. What lab value should be monitored in a patient receiving long-term prednisone therapy? Answer. Blood glucose. Rationale. Prednisone can cause hyperglycemia, especially in long-term use. Monitoring blood glucose detects early diabetes or worsening glycemic control. 139. What is the most critical side effect of risperidone in elderly patients with dementia? Answer. Increased mortality risk. Rationale. Risperidone increases the risk of stroke and death in elderly patients with dementia-related psychosis. Nurses should monitor for cardiovascular symptoms and use cautiously. 140. What is the primary nursing action for a patient with a gentamicin trough level of 3 micrograms per milliliter? Answer. Hold the gentamicin dose and notify the healthcare provider. Rationale. A gentamicin trough level above 2 micrograms per milliliter indicates toxicity, risking nephrotoxicity or ototoxicity. Holding the dose and notifying the provider allows for dose adjustment. 141. What is the most common side effect of potassium-sparing diuretics like triamterene? Answer: hyperkalemia. Rationale: triamterene reduces potassium excretion, leading to hyperkalemia, which can cause arrhythmias. Monitoring potassium levels is essential. 142. What is the priority nursing action for a patient experiencing serotonin syndrome while on venlafaxine? Answer: discontinue venlafaxine and notify the healthcare provider immediately. Rationale: serotonin syndrome, caused by excessive serotonin, is life-threatening. Stopping the drug and notifying the provider ensures supportive care and symptom management. 143. What is the most critical adverse effect of linezolid in patients with MRSA infections? Answer: bone marrow suppression. Rationale: linezolid can cause thrombocytopenia or anemia, especially with prolonged use. Monitoring complete blood counts, CBC, is essential for early detection. 144. What is the primary patient education point for a patient prescribed fluticasone nasal spray? Answer: use consistently for best results and report nosebleeds. Rationale: fluticasone requires regular use for optimal allergy control and can cause epistaxis. Educating patients to report nosebleeds ensures timely evaluation. 145. What lab value should be monitored in a patient receiving long-term lithium therapy? Answer: thyroid-stimulating hormone, TSH. Rationale: lithium can cause hypothyroidism with long-term use. Monitoring TSH detects early thyroid dysfunction, allowing for thyroid replacement therapy if needed. 146. What is the most common side effect of alpha blockers like tamsulosin? Answer: orthostatic hypotension. Rationale: tamsulosin causes vasodilation, leading to blood pressure drops upon standing. Nurses should educate patients to rise slowly and monitor for dizziness. 147. What is the priority nursing action for a patient with a fentanyl overdose? Answer: administer naloxone and monitor respiratory status. Rationale: fentanyl overdose causes respiratory depression. Naloxone reverses opioid effects, and monitoring ensures airway protection and adequate ventilation. 148. What is the most critical side effect of cyclophosphamide in cancer treatment? Answer: hemorrhagic cystitis. Rationale: cyclophosphamide can cause bladder irritation and bleeding. Nurses should ensure adequate hydration and administer mesna to prevent this side effect. 149. What is the primary nursing action for a patient experiencing a rash while on allopurinol? Answer: discontinue allopurinol and notify the healthcare provider immediately. Rationale: allopurinol can cause severe hypersensitivity reactions, including rash or Stevens-Johnson syndrome. Stopping the drug and notifying the provider ensures urgent care. 150. What is the most common side effect of H2 receptor blockers like ranitidine? Answer: headache. Rationale: ranitidine, used for acid reflux, commonly causes headaches. Nurses should educate patients to report persistent or severe headaches for evaluation.